You know that moment, right? The one that makes a parent's heart just sink. Your little one has been sick with a fever, and you're so relieved when it finally breaks. But then you see it. A rash starts to appear, and your mind just goes into overdrive. What is this? Is it bad? So let's break this down, because really understanding the difference between two very common childhood illnesses, measles and roseola, is one of the most powerful things you can know to protect your kid. So, yeah, this is the classic scenario we're talking about. A fever comes, then a rash follows. And at first glance, they can look so similar. But what's going on under the surface is completely different. These are two vastly different illnesses, and figuring out which one it is, well, it's absolutely critical. And here's the bottom line why it matters so much. Roseola, for the most part, is pretty mild. It kind of just runs its course and goes away on its own. Measles, on the other hand, that's a serious infection. It can lead to some really severe, even life-threatening problems. That's why being able to tell them apart, and quickly, is your absolute best first move. Okay, so we're going to look at a few differences, but honestly, there's one massive clue that almost always clears up the confusion. And it's not really about what the rash looks like, not at first anyway. It's all about when it shows up. It all comes down to timing. Seriously. All right, let's take roseola first. Picture this. Your child has a pretty high fever for, say, 3 or 4 days, and then poof, it's gone. It just breaks. It's only after that fever disappears that you'll see the rash pop up. And here's the real kicker. When that rash appears, your kid often starts feeling a whole lot better. They're more playful, they're getting back to their old self. So weirdly, that rash is actually a good thing. It's like the finish line. Now, measles, it's the total opposite story. With measles, the rash comes out right in the middle of the sickness, while your child is still dealing with a high fever and feeling awful. As one expert, Dr. Trung Hugh Khan, puts it, if you see a rash while the fever is still raging and there's a cough, you need to be thinking measles. So in this case, that rash isn't the end of the sickness, it's a sign that things are at their worst. Beyond that critical timing clue, the rashes themselves just look and act differently. A measles rash is usually a much deeper red. It's raised, it's bumpy, and all the little spots tend to join together to form big patches as it spreads down from their head and face. The roseola rash, on the other hand, is typically a lighter pink, it's flatter, and it usually starts on the chest or back. And there are a couple of other dead giveaways for measles. One is something called Koplik spots. They're these tiny white dots inside the mouth. They can look like little grains of sand. And after the rash is gone, measles can leave behind brownish marks on the skin, sometimes called tiger stripes. Roseola, it doesn't do any of that. It just fades away. Okay, so we've been talking about telling them apart. But why is it so critical? Well, because measles isn't just another childhood illness. It carries some very real, very serious dangers. For starters, measles is just unbelievably contagious. I mean, think about this. One single person with measles can spread it to almost 20 other people who aren't vaccinated. It just hangs in the air. It is one of the most infectious viruses known to man. But here's the part that's truly terrifying, something most people don't even know about. It's called immune amnesia. The measles virus doesn't just make you sick for a week or two. It actually attacks your child's immune system and, get this, it wipes the system's memory. It makes the body forget how to fight off other germs it was already immune to. This can leave a child vulnerable to other serious infections for years. It's just devastating. And the immediate complications? They can be awful. We're talking about things like pneumonia. About 1 in every 20 kids with measles will get it. That's like 1 kid in every classroom. And then there's encephalitis, which is swelling of the brain. It can cause permanent brain damage, deafness. These aren't just small risks. They can change a child's entire life. Okay, I know that was a lot, and it's heavy stuff. But the good news is, you're not powerless here. So let's talk about your action plan, what you can do right now and for the future. All right, first things first, no matter what, you want to focus on making your child comfortable. That means keeping that fever down with whatever your doctor recommends, like paracetamol, and push fluids, water, juice, anything to keep them hydrated. After that, it's the basics you already know. Lots of rest, easy to eat foods like soups or porridge, and keeping them clean to help prevent any other skin infections from popping up. But, and this is super important, you have to know when it's time to stop home care and get to a doctor immediately. If that fever is super high and just won't come down with medicine, call someone. If your child is really lethargic, sleepy, and hard to wake up, that's a serious sign. And obviously, if they're having trouble breathing or have a seizure, that's a trip to the emergency room, no questions asked. Don't wait, Don't second-guess yourself. When you look at all this, it all points to one crystal clear conclusion. While there isn't a vaccine for roseola, measles is almost entirely preventable. The absolute best, single most effective way to protect your child from all of this is the measles vaccine. It's simple, it's safe, and it works. And the schedule is really straightforward. The first dose is at 9 months. The second one comes a little later, between 12 and 15 months. And then there's a booster shot right before school starts, somewhere between 4 and 6 years old. Follow the schedule and you're giving your child about 98% protection against measles for life. That's incredible. So let's circle all the way back to that one crucial clue we started with. Rash after the fever is gone, you can breathe a little easier. It's probably roseola. Rash during a high fever, that's your signal to suspect measles and act fast. Knowing this one simple thing isn't just a fun fact, it's a tool. It gives you the power to see what's happening more clearly, to ask the right questions, and to be the very best advocate for your child's health, right when they need you the most.
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.